Hi, my name's Sophia, and the topic that I was given to present on is Ebola. Ebola virus disease is a severe and often fatal illness that is caused by a filovirus. Understanding Ebola is important scientifically and ethically because learning how this virus spreads and affects the body can help us provide better support and care, as well as protect very vulnerable populations. This connects to the Christian principle of bearing one another's burdens as described in Galatians 6:2, where it says, share each other's burdens and in this way obey the law of Christ. Public health responses such as outbreak control and medical aid, as well as global research, demonstrate compassion in actions as we work to support affected communities. Studying this disease helps us recognize both the medical challenges and the human responsibility to serve those who suffer. Signs and symptoms. Ebola symptoms typically appear between 2 and 21 days after exposure, which can make early detection pretty difficult. Initial symptoms resemble common illnesses like influenza. So these symptoms can include fever, headache, muscle pain, and fatigue. This can make misdiagnosis pretty common and very likely in regions without strong healthcare symptoms because they aren't exactly able to differentiate what the diagnosis could be. Um, as the infection progresses, patients often develop vomiting, diarrhea, rash, and impaired organ function. In severe cases, the virus causes internal and external bleeding as blood vessels become damaged. Without timely intervention, the risk of organ failure and shock increases. Mortality rates remain high in many outbreaks, especially where medical resources are limited. Causative agents. Ebola virus belongs to the Filoviridae family and are recognized for their distinct filamentous structure. The picture on the right shows the viral structure of Ebola. This virus uses surface glycoproteins to bind to host cells, allowing it to enter and replicate rapidly, which causes Ebola to spread. Evidence suggests that fruit bats act as natural reservoirs, meaning that they can carry this virus without being harmed or becoming ill. And although transmission to humans can occur through infected animals or through contact with infected individuals, because Ebola is an envelope virus, disinfectants, bleach solutions, and high heat can effectively destroy it by breaking down its lipid envelope structure. Its structure explains both its infectiousness and its sensitivity to proper sanitation practices. Pathogenesis. Once Ebola enters the body, it targets immune cells such as macrophages and dendritic cells, which normally help coordinate the immune response. This virus disables these cells, preventing the body from recognizing and controlling the infection. This leads to a massive release of inflammatory molecules known as a cytokine storm. This damages blood vessels and causes them to leak. As fluid escapes the bloodstream, blood pressure drops, and multiple organs begin to fail. Without aggressive supportive treatment, including IV fluids, oxygen, and careful monitoring, patients can rapidly decline. This rapid pathogenesis is what makes Ebola so dangerous in areas lacking advanced medical care. Epidemiology. Ebola outbreaks most often occur in regions with limited medical infrastructure and sanitation resources. Factors like crowded living conditions, limited access to clean water, and shortage of protective equipment increase the spread of this virus. Cultural practices also play a huge role. For example, traditional burial rituals that involve touching or washing of the deceased can easily transmit the virus because the bodily fluids still remain contagious. During the 2014 and 2016 West African outbreak or epidemic, delays in identifying the virus overwhelmed healthcare systems, and insufficient protective gear contributed to widespread transmission and thousands of deaths. These patterns highlight how environmental and socioeconomic conditions shape disease outbreaks and treatment and prevention. So, although there's not a single cure for Ebola, supportive treatment greatly improves survival. This includes the IV fluids, electrolyte balance, oxygen therapy, and medications that will support organ function. New antiviral drugs and vaccines have also become important tools for reducing mortality and preventing future outbreaks. Prevention remains essential, especially in low resource settings. Key strategies include proper sanitation, consistent use of personal protective equipment, safe burial practices, and community education about avoiding contact with infected bodily fluids. From a Christian perspective, these efforts reflect Philippians 2:4, which encourages caring for the needs of others. Public health work becomes a form of stewardship, compassion, and service to vulnerable communities. And then this is my reference slide. And thank you so much for watching. Hope you enjoyed.